Only on 10 News, allegations that agents with the Department of Homeland Security are putting American lives in danger.
Tonight, claims that the government is not providing adequate medical care to some citizens in its custody. Our Team 10 investigator Adam Rakrusen has been looking into this for weeks.
People that I talk to blame an overwhelmed system, saying Customs and Border Protection doesn't have the resources to deal with the demand. They say rather than taking some people they arrest who are addicted to drugs and alcohol to a hospital or nearby medical facility, they were put in holding cells and ignored. I sat in court last week and heard a San Diego federal judge say the government could do better. At the intersection of Mexico and the United States sits a concrete and steel barrier. What you're looking at is the San Ysidro Port of Entry. It's the busiest land port of entry in the Western Hemisphere, a place where not everyone who tries to get through is allowed to. In February of this year, a U.S. citizen named Mark Oliver Lewis was arrested at the San Ysidro Port of Entry, accused of trying to bring someone into the United States illegally. According to court documents, after his arrest, Lewis told agents that he uses large amounts of alcohol and heroin. Later that day, Lewis was transported to the Metropolitan Correction Center in San Diego for booking, but court records show he was rejected because he was experiencing withdrawal and taken back to the San Ysidro Port of Entry instead of a hospital for detox.
They put him in a holding cell with up to 20 other individuals. And just basically ignored him.
Brody McBride is Lewis's attorney. He says Lewis started to experience severe detox and withdrawal symptoms. He had difficulty breathing, chest tightness, racing heart.
He was in so much pain he couldn't get up to use the bathroom unassisted. He ended up vomiting on himself, defecating on himself. Meanwhile, the officers provided no treatment.
McBride says Lewis transferred cells, but was left in those soiled clothes without a bed or medical attention for 4 days, until he was eventually transferred to this federal correction center in downtown San Diego. In court transcripts obtained by 10 News, a federal judge said, reasonable people would say, yeah, we don't want someone sitting around in clothing in which they've defecated. We're not going to do that. That's not a humane thing. This is not some third world country where we treat prisoners like that.
To leave these individuals in this condition for this amount of time without any treatment, I'd say is probably closer to torture.
Lewis is suing the government. So is a woman by the name of Amanda Sams. McBride represents both of them. Sams was arrested in January for allegedly trying to get someone into the country illegally. According to her lawsuit, she told agents she was an alcoholic and addict. The complaint says officials tried to transport her to the Metropolitan Correction Center, but she was also rejected. And instead of being taken back to a hospital for detox symptoms, she was taken back to a DHS holding facility.
Put her in a cell in the basement and left her there for 4 days.
McBride says Sams was not seen by a doctor, nurse, or other medical provider. When she begged for help, she was told, "You're not our problem."
They're entitled to a base standard of medical care if the government is going to arrest them and hold them in custody.
Documents obtained by Team 10 show more than just 2 people suing the government have gone through detox at the San Ysidro Port of Entry. This is what's called a no-body active list. It's a list provided by the government showing who will not be arraigned that day, the reason for the delay, and the defendant's location. A report from March this year shows 2 additional people detoxing from heroin at the San Ysidro Port. Team 10 tried to get all the no-body active lists from the start of this year, but so far the U.S. Attorney's Office has not turned them over, saying they aren't public documents. What we have gotten from the government is a statement from Customs and Border Protection, saying they can't comment on matters that are currently under litigation. They sent us this policy document that explains national standards on transport, escort, and detention. Court documents also reveal that there are physician's assistants and other medical personnel on staff at the port, but doesn't clearly state how many hours a day. A supervisor testified detainees are offered food, water, and are observed every 15 to 20 minutes. But that observation does not involve checking vitals, blood pressure, or heart rate. Staring out at the border, McBride says despite their past and current arrests, these are American citizens.
If they keep this up, you know, there's a good chance that they're going to put somebody in the basement that's not going to make it through.
In court, an attorney for the government told the judge that procedures have been changed. Now people who are brought back to the port are seen by physician's assistants every shift, which is every 6 to 8 hours. Adam Rakusin, Team 10.